On today's NHI chat, NHI's medical director, Dr. Harlan Vanterpool, talks about his presentations at the BVI Red Cross Men's Health Fair on January 25th.
So I started the presentation with a general overview and sort of a shock treatment for the persons there, where I focused on the top 5 chronic diseases that we've noted since 2016 at the beginning of the NHI, which is hypertension, diabetes, cancer, cardiovascular disease, and renal disease. I also gave some facts that were taken from the STEP survey, which was done in 2009, which was an overview. It was a randomized sampling of our population, and it discovered quite a few things that were very telling about the BVI population in terms of health-seeking behavior and health patterns and disease trends that we were seeing. It suggested that things like 15% of the population is actually diabetic. It suggested things that over 41 or 42% of men consume alcohol on a regular basis, and 27% of them actually drank heavily. So I shared those things with the audience, sort of to emphasize and highlight the amount and importance of what's actually happening in chronic diseases in the territory, that the incidence is high. Second to that, I also highlighted the fact that there was over $80 million spent on health care, and that's health care not only from the local aspect, but what's been sent overseas. So money spent on health care for the last at least 10 years have been in excess of $80 million a year, and that's climbing. The attendees, I think, were very appreciative of the information. Ms. Benjamin was able to share with them as well what the NHI, some of the processes in terms of accessing care and that kind of stuff. And persons had a lot of questions around, details such as whether or not they have choices and where they're going. Choices are clear. We always have a choice. What the NHI tends to do is to try to present some options, and the options are based on the ability of the person, what will fit their needs best. In a nutshell, the National Health Insurance was designed to provide what I call the 3 A's to the populace, to ensure that healthcare remains and is affordable, it's accessible to all, and it's appropriate, meaning that the treatments, whatever providers provide, is appropriate quality and appropriate management for particular ailments. So that's generally the concept of the 3 A's. Well, my main concern is typically the health-seeking pattern or behavior of men. Generally, our men do not seek health care until there's a notable problem for most. Whereas I tend to say that women are more prone to visit a doctor in their prime years, because those are the childbearing years. So they at least would have seen a gynecologist maybe, and if they had some other issue, they would tend to pick those up. Men, on the other hand, during their prime years, oftentimes don't go to a physician unless they have a definite problem, whether it's something like a back issue or something like that. And then, of course, if they tend to visit doctors with issues with libido and those type of things, when things don't work like they're accustomed to. Because I'd like persons to practice proper health-seeking behaviors, and also to consider their wellness, their overall wellness. And so I encourage during the chat persons to just do basic things: drink plenty water, get adequate rest, exercise, watch your diet, watch your stress levels, etc. Find healthy ways to decrease your stress levels. those are the type of things I was encouraging all persons and all attendees to bear in mind and understand the impact that they actually have on their overall health when you do these things and take them seriously.